Hello. So, one of the things I want to talk about today is something that I know a lot of patients that have been infected with coronavirus and they've gotten through the period of being that 10-day, 14-day isolation. They're feeling better. They get retested and they're positive. And so I want to talk about that today to bring some clarity to people that in the future, and also the people that have had coronavirus and have gone through everything, feeling better, and they're positive. I want you to understand what that positive probably means. So, there's been a few studies, and actually several studies around the world trying to figure all of these things out. All of this is new. We've only been in it for about 6 months. So, scientists and doctors and medical people all around the world are trying to get their hands around this. But the one thing that is really complex is a complex thing is the patient's better, they were sick, they were positive, they're ready to go back out into their regular routine, their work, their job, their school, and they're still positive. Korea did one of the studies I looked at, and I'll send you the link below. They did a study where they had 200 and I think it was about 285 patients that were infected and they had recovered and they tested positive. And of course that was at that time that was complexing to them. And so what they did was they took those 200 plus people that had been positive but were better, but they were testing positive still, and so they put those people with about 700 people that were negative. These people were negative. Guess what? None of the patients that were negative were infected from the positive patients. Okay. So what that says, or what that implies, is that positive test from that patient that has recovered seems not to be contagious, because none of the 700 plus patients became positive. They went a step further. They got blood samples from the patients that had been positive and had done better, and they were still positive. They got blood samples from those patients, took them to the lab, cultured the viruses. Nothing grew. Nothing grew out of the lab. No viruses. So guess what? That implied that we were either dealing with dead virus, okay, or fragments from the dead viruses. Now, one thing that is really important, and I know this might get a little scientific, so follow me closely. The PCR test that we do, that nasal swab, if anybody's been tested, that goes all the way up almost into your eyeball, and you feel really bad. That test is a really good test because it tests the DNA. Actually, it's the RNA of the patient. It tests the RNA of the virus. Okay, so that goes up into your nose. So if there's any viral particles, dead or alive, it will test positive. And so what we can assume or presume from these patients that have been sick, tested positive initially, and now they're through their 14-day quarantine and they're still testing positive, what this test and what these experimental studies would suggest is that these positives that we're getting after are dead viruses or particles of RNA that are there that are testing positive. There was another study done by the American Medical Journal back in February that demonstrated that even after a person had been infected with COVID-19, that for about 2 weeks after they were quarantined and they were doing well, 2 weeks the virus stayed in the body. The viruses stayed in the body and slowly came out. Those viruses were not contagious. And I'll leave a link to that, and so you can read a little bit more about that. But the fact is that after the 2-week period, it showed in this study that the virus still is in our bodies for about 2 weeks, even though we're feeling better and we're doing better. And so these studies are compelling, and they're giving real strong evidence that if a person has gone through the whole process, been sick, tested positive, feeling good, and now still testing positive, I think that now that we're getting more information, that we can safely say that those patients that are testing positive, even after the 2 weeks, and they're feeling great, that they're okay to go out. So the positive results that we're getting back from these patients that were infected is pretty strongly supported that those positive results are not contagious. Those people are not contagious. But more likely that the positive results that we're seeing in these patients are from either dead viruses. We saw that in the lab when they went back to culture them, nothing grew, or from fragments of RNA or the DNA that from the virus. So with that being said, many experts around the world are really thinking and saying that those patients that are positive after going through their infectious process, those patients are not infectious. They're not contagious, even though their results are positive. And so that's a little bit more information. I hope I've given you a little bit more understanding of how this virus works. Things are changing all the time. The CDCs around the world are having to change things from 1 week to the next week. But I think that we're getting closer to understanding how this virus works. And so my job is to bring it down to the non-medical person, to the lay person, and so that you will have an understanding. And so if somebody's been infected and you hear that they're still positive, that you don't get real freaked out and say, I don't want to be, around that person. So if you like this video, if you want to know more information about it, click the like button below and subscribe to our channel.